Well, there's new research that reinforces what we already know. Getting too little sleep is bad for you. But this new study suggests not getting enough good sleep poses long-term health risks, including higher risk for Alzheimer's. Dr. Ernest Patti is a senior attending physician of emergency medicine at St. Barnabas Hospital. Dr. Patti, good to see you.
Thanks, Leah.
Thanks for being here. So we're talking things like hypertension, diabetes.
Right. Obesity, depression, syndromes like this. And now that study also touched on Alzheimer's as possibly being linked to sleep deprivation in Americans.
So 40% of Americans and 70% of teens say that they don't get enough sleep. Why is that?
Well, I would say today, with our high-paced, fast activities, lifestyles, you know, people are taking their cell phones to bed, their computers to bed, they have televisions in the bedroom. The bedroom really needs to be your sanctuary of rest, and you really need to pay attention to preparing yourself for sleep. And there's a number of things that we should do in order to do that.
Since you mentioned it, I think we actually have some tips. Let's put those up on the screen for you.
We do.
The first one, adults need 7 to 8 hours of sleep a night. Teens need at least 9.
That's true.
Another tip, you should go to bed at a consistent time every night. Why is that important?
Well, it's important because you want to set a routine for sleeping. Everything in our lives are scheduled. The one thing we forget about and we deprive ourselves of is sleep. Some folks actually set an alarm clock to remind them when it's time to go to bed. And you can do that with your iPhone and your smartphones. It's very easy to do.
Okay, an alarm clock to tell yourself when to go to bed. All right.
Exactly.
Another tip, let's put some more up there for you. Talk to your doctor if you think that you have a sleep disorder. What kinds of sleep disorders are we talking about
We're
here?
talking about sleep apnea, restless leg syndrome, things like that. Many people actually do go to bed, but they don't sleep restfully. And if you're not sleeping restfully, then you're still exhausted when you wake up. And that's preventing your body from healing and also decreasing your immunity. So things that can help stimulate good sleep: a walk after dinner, some exercise before bed, and definitely cutting out on the alcohol and caffeine after noon. Now, I know some people are going to disagree with me on that, but it's really important to, if you're sensitive to caffeine and alcohol, definitely cut back on that because that can keep you up at night.
Okay, so you just said it. You should exercise to improve sleep, avoid alcohol and caffeine.
Yep.
And then you said ditch the electronics,
Ditch the electronics.
Why is that a problem? So many people want to read before they go to bed. They think it might help them kind of fall asleep, sitting there looking at your iPad. Why is that a bad thing?
The blue lights that are emitted from computer screens really sort of trick our brains into and disrupt our sleep patterns. So they actually prevent us from going to bed. I agree with reading before bed. Reading is great, but old-fashioned books, you know, they don't create that syndrome in your brain where it keeps you awake at night.
All right.
So,
well, since we're talking about health, let's also talk about some exercise. You know, while walking is good for exercise, older adults, it actually turns out that running can actually make your body more efficient, leaving people with more energy for other tasks.
that's right.
Tell us about that.
Well, what they found from the study that we were reading is that folks who run, older folks who run, definitely have an increased drive, I should say, to continue to walk more during the day. So that increases their metabolism and just keeps them fit. Whereas walking in any form is beneficial to the body. So I would suggest don't decrease your walking. If you can, and it's safe for you to run at an older age, you know, if you don't have knee, hip, and back problems, then start a gentle running program because it will stimulate your metabolism and also increase your drive to walk more during the day and cut down on, you know, taking elevators and escalators and things like that that decrease our walking.
Okay, now the study that we're referring to, it actually took 15 men and 15 women. Their average age, you said older, but their average age was 69. People who are already consistent runners or walkers, you know, put them on specialized treadmills and measured kind of what was happening with their body. Can you explain, you know, the tests that they were doing and then kind of how that information came about?
Well, I won't get into specifics because it's hard to say, you know, or to put it into language that people can understand. But basically what they were doing was looking at their metabolic rates. They were also looking at the oxygen consumption and the way in which the body functioned at a cellular level. So when you're fit to that level, and your body can utilize the oxygen and create energy more efficiently, then your body's going to work at a peaker level of performance than someone who's more sedentary and maybe just walks a minimum amount during the day. So the running and the walking, both in fitter individuals, will lead to better health benefits down the road.
My personal trainer always says, if you don't feel like running, at least just go out for a walk, right?
That's true. No, I said that earlier on. Definitely walking is the best. Running would even make that walking even that much better.
All right, and it's exhilarating too. Dr. Ernest Patti, thanks so much for being with us.
Pleasure for being here, Leah. Thank you.